greatest asset are your people. And without your people, your organization isn't going to run. There's always some service that can be provided. There's something that you can do as an employer. And it's a benefit, certainly, for the employees. My team in particular, because we're all somehow involved in health promotion, we want to help people, and we want to help people become healthy.
The thought about wellness, it isn't just about having world-class medical facilities. Health and wellness is more than just medicine. It's about having a good spirit. It's about being spiritually strong and having good feelings.
We're taking John Muir services on site and bringing healthcare to the workplace. We have to meet all the employees and kind of let them know and communicate to them what is happening. We're a third party. We're not your human resources department. We're not your benefits department. We're coming in and we're providing these services, and we cannot communicate individual results back to that employer.
Yeah, the city's had as a benefit to the employees a wellness program for a number of years. We happened to have a health fair that day, and I just took a chance and just said, I've been experiencing some shortness of breath.
Kind of looked at his numbers and I said, well, something's happening here, because I said, your numbers are kicking up a bit. And I said, I need you to call the doc.
Really, when you say the last couple of blood pressures have been unusual, and to have just sort of look down a list and say, you can see the anomaly. I called Sharon directly. I had, they have their business cards there, and I actually called directly. I didn't go through human resources.
We pulled our records and, kind of got everything ready for him to go meet with his physician.
And I went in and I told them the story about what had happened and, why are you here? And I said, well, I had here's a whole history of my blood pressures over the last 5 years. They were amazed that I even had that information.
I got a call from the Human Resources Department. She said, well, you know about Scott, right? I said, well, what about Scott? And she said, you need to call him. She said, he's at home and he's recovering, and she said, he wants to talk to you.
Discovered that this aneurysm was huge. It was 3 inches across by about 9 inches in size.
The only reason why it was picked up is because of the blood pressure screenings with Scott. It was that kind of that near miss.
I wrote a letter to my employer afterwards, after I recovered from the surgery, and it's basically thanking the city for having that employee benefit and recommending that we keep it. Now, there are budget constraints that cities and most employers are going through, but here's a benefit that, when you look at the big picture, it can't be that much money to provide that kind of benefit. And how many lives does a program have to save for it to have incredible value for the dollar?
I just think about how many other people are out there, that potentially we could help, if they participated in these types of programs.